Hi, my name is Amy, and this is my discussion video of reducing healthcare harm. After watching Chasing Zero, my first thoughts were of the razor's edge the nurses walk between helping and harming our patients. Even with the best intentions and the highest level of education, human error is always a factor in either providing appropriate and life-saving care or prematurely ending the lives of our patients. My takeaways from this video were that even though the content and the movement happened in the 90s, there are still countless instances that I've either witnessed or heard of in which human error has brought harm to patients. I am sure that the rate of preventable deaths and injuries has gone down significantly with advancements in technology and movements such as Chasing Zero. But with humans being the core of nursing staff, I do not believe that the healthcare system will be able to do anything besides chase zero until we band together as one. The video left me with a lasting impression that even though humanity can never achieve true perfection, this does not mean that we should not try to stay in the movement at full force. For even a single life being spared from harm is very much worth the efforts of reducing harm from human error. The best way to prevent healthcare harm from human error is simply to maintain awareness of this movement and its ideal, and that's by sharing the personal stories of humans. While many can be tragic and others uplifting, all stories have intrinsic value in teaching others. My own personal story, thankfully, ends well, but it is an instance that haunts me with the untapped potential for harm and death that could have resulted from my hands. I was working in the ICU and had been there for about a year. I felt much more confident than when I first started, but I was keenly aware that I did not know everything. I still don't. So when I was tasked with orienting a new nurse for the first time, I was flattered but flustered. What if I taught them wrong? What if my teachings helped them to harm someone in the future? I was determined to do the best I could in welcoming the new face to the critical care unit and teaching them the best that I could. So I was hyper-fixated on teaching them as much as I could and was not paying as much attention to my patient as I should have. This patient in particular that we shared was receiving a continuous infusion of nitroglycerin, which was something I had never done before in the ICU, but was happy to learn about while working with the orientee. I quickly learned during bedside reports the parameters for increasing, decreasing, maintaining, and stopping the rate of the drip. Saw that it should run very, very slowly, and then moved on with the shift work. While I was showing the new recruit how to work the pumps, fill out the patient board, and do other nursing-related tasks, I saw that the nitroglycerin bottle needed to be replaced. This was no problem, and I happily showed my orientee how to switch the new bottle in. No problem. After we took care of this patient and the other one in our assignment, I saw that the bottle needed replacing again. There was no leakage on the floor that made me immediately think something was wrong, and the pump rate was correct. So I didn't pay attention to the fact that it should not have run out in 2 hours' time. I was trusting the machine to do its job. We replaced the bottle, went to the charting station, and then did our rounds. And then again I saw that the bottle needed replacing. It wasn't until I was bringing the third bottle into the room that someone other than myself realized that the pump, while displaying the correct rate for infusion, was actually infusing the nitroglycerin at 10 times the rate it was programmed for. If I had but taken a moment to see the bottle physically infusing faster than the programmed rate displayed on the machine, I would have noticed that something was wrong with the internal mechanism of the pump. Thankfully, my patient had a rare and unknown genetic resistance to nitroglycerin, so they were actually unaffected entirely by the medication. If it had not been for that random team member picking up on the mechanical issue and the patient not having this rare genetic trait, I would have killed my patient. I wish that there had been a hard stop or some sort of alert on the Pyxis for my high rate of withdrawing nitroglycerin on the same patient, because it would have made me stop and wonder why this medicine was running out so quickly. To this day, I can still see the looks of distrust, disappointment, and fear on the faces of the patient, his family, and my orientee, and I will never forget that. I share this and all of my other stories because even though it is scary to think of how close I was to killing another person, and it brings me great shame to know that I failed to take basic observations in his care. I know that sharing these stories helps me prevent these feelings and experiences in other nurses, prospective students, and patients. Sharing stories has helped to keep in perspective the real dangers of letting ego, misinformation, poor time management, and any other aspects of being human from overpowering the evidence-based procedures and policies in place to keep our patients safe. By chasing zero, I believe that we can and will do our best, reducing and maybe even one day eradicating the preventable harm that is still prevalent in healthcare. Thank you.